Hi, this is Julius from Black Urban TV YouTube channel. Today we are going to discuss health talk. We are going to discuss H.Pylori. Mamangu anaita stomach ulcers. The sweetest thing about health is that what makes us equal has no equal. H.Pylori ni mtu mwenye ako state house na mtu mwenye ako kwa street wako tu na H.Pylori same. Wana claim ati prevalence ya H.Pylori ranges from 60% to 95% depending on your village. So we have here Dr. Dongo. He's going to enlighten us in regards to H.Pylori. Cliff here is going to enlighten us in regards to pathological aspect of the H.Pylori. On my right side is our crew members. They're going to ask questions to Dr. Dongo. So for now, let's start this discussion by asking Odongo to explain what H.Pylori is. Please.
Thank you, Julius. My name is Dr. Dongo. Thank you for another opportunity for me to enlighten our viewers on H.Pylori, just like we did the other time on sickle cell. Kindly subscribe to our YouTube channel for more videos that are coming. Because of the nature of our viewers, I will try again to be very simple. I will not use the technical terms in this discussion. So H.Pylori is a common thing. Some people wonder what is this thing. Yes, so it has been baptized so many names. When somebody goes to the hospital, they are told they have H.Pylori, they come home and say, nilipatikana na ulcer. Yeah. So maybe let's just try to understand what H.Pylori is. So H.Pylori is a bacteria, just like millions of bacteria that we have. The reason why we are going to discuss it is because of the significance it has if you continue having it in your body for long. So generally H.Pylori is found in every part of the world. Statistics say that it is found in half of the world population. Actually, half of the world population has H.Pylori. In certain regions it could even be higher, up to 80%. And what we are saying means every 10 people tested for H.Pylori, you could even have up to 8 testing positive. Now, H.Pylori resides in your stomach, in simple terms. When you acquire it, it goes and resides in your stomach, and that is where it causes problems. Maybe just to understand what happens when this bacteria hides in your stomach, that makes it so important that we are going to discuss about it today and not any other bacteria. It is a very special organism. We know that everyone knows, especially if you have gone through the basic education, that in your stomach you have acid. And it is basic knowledge that in addition to several functions of this acid in your stomach, one of the things it helps in killing germs. And yet we are having a bacteria that is surviving within the stomach. What makes it special, that makes it survive in the stomach, is what leads us to the problems that we are going to discuss. Now, how do you acquire H.Pylori? We say that most of the H.Pylori is acquired in childhood. Actually, most of the people, by the time you reach age 10 years, you have acquired H.Pylori. But by the time, majority, for those who are going to get H.Pylori, by the time they reach 50, about 80% of everyone who gets H.Pylori at the end of the day, by the time you reach age 50, about 80% of those people have gotten H.Pylori. So when you get H.Pylori, how do you get it? Traditionally, it is not well known how you get H.Pylori into your body, but perhaps there are other means that people have studied, and we suspect that you either get it through oral or fecal oral. Oral means if I have it, I can pass it through to another person through direct contact with the mouth, exchange of saliva.
Aromatherapy.
Yes. Another way, you can get it from contaminated things. So the contaminated things could be contaminated food or contaminated water. Now when you get the H. pylori, now it resides in your stomach. One of the most important things it does are two. There are several things it does, but two of them are most important. Number one, it will destroy the mucosal lining. In your stomach, there's a mucus layer that is supposed to protect you from the effects of the acid. So that is the thing it destroys. So once that mucus layer has been destroyed, the inner lining of your stomach becomes very sensitive to the usual acid that under normal circumstances you are not sensitive to. The other thing it does is it induces inflammation. It means it recruits, I will not go into details, but it recruits the inflammatory cells that most of the time you use in fighting infection in your body. Once they are recruited into your stomach, they induce inflammation, and that is where the problem starts. So remember two things: we are destroying the layer, the mucus layer, and we have also recruited the cells, and then we are having inflammation in the inner lining of your stomach. Now, if you continue having this bacteria in your stomach for a very long time, there are repercussions for that. Now, you will end up having what we call gastritis. Gastritis simply means inflammation of the inner lining of your stomach. We've said it induces inflammation. If you don't deal with the gastritis, then you will start poking holes, what we call the ulcer. And if you don't handle the ulcer well, the ulcer can turn to be a cancer, what we call stomach cancer. So it is because of this complication that comes from chronic infection with H. pylori that we make this topic a very important topic. Now, how do these people present, the people who have H. pylori in their stomach? Majority of people with H. pylori, actually about 8% of the people with H. pylori do not have any symptom. But if you are going to develop symptoms, these are some of the symptoms we'll develop. The most common symptom is usually pain in your stomach. I'm just going to say stomach to make things easier, but pain in the abdomen. So it is a burning pain that is worse when you have not eaten. So you'll be getting pain in between the meals, or late at night. If you take your supper at around 8, 6 thereabout, ukiendelea kulala when the food is already consumed and there's gastric emptying and everything has been cleared, then you're likely to develop pain late in the night because now your stomach is empty. So it is abdominal pain on and off, worse before eating, and sometimes it is improved when you take drugs that lower the acidity. Other symptoms that you will present with, not in everyone, but you can develop nausea. Some people vomit, some people you feel bloating, you feel a lot of gas in your stomach, you feel like you've eaten, you just eat kidogo and you feel like you're full. Some people even end up having unexplained weight loss. Yeah, because you're not eating well, because of the symptoms you have in your stomach. Now, if somebody has these symptoms, definitely you want to test them. So, whom do we test? Do we test everyone? Of course, we say every person that presents with these symptoms I've talked about, basically we summarize them as dyspeptic symptoms in our medical term. So everybody that presents with these symptoms, especially if they are age 60 and below, they must be tested for H. pylori. But people who are above 60 years, anybody who has 60 years and above, and they have new onset of the symptoms you have described, then just testing for simple H. pylori through the lab is not enough. These are who you take for endoscopy, and then they will be tested for H. pylori through endoscopy that we are going to discuss about. So what are the tests that we do for these people? The tests, we divide them as being invasive or non-invasive. Non-invasive tests include things like you will give us your stool and we look for the H. pylori antigen in your stool. Other tests that will not go into details, we call the urea breath test. You will be given something, you drink, then you breathe, and we will know how to interpret it. I will not go into details. We also have blood test for H. pylori, but this is not commonly used because it is not able to tell us whether, even if you get the result as being positive, it cannot differentiate between active infection currently or an infection that you had before. I've talked of endoscopy. When they do endoscopy, they take a sample from your stomach, and this can be tested directly either through histology or what we call rapid reverse test to test for the H. pylori. Now, everybody who has symptom and has tested for H. pylori must be treated. I hope you remember that. Yes, everybody who has symptoms and has tested positive for H. pylori must be treated, and we treat you with antibiotics because this is a bacteria, and because of the uniqueness of the bacteria, we have different combinations. Again, I will not go into details. We combine the antibiotic together with the drugs that reduce the acidity in treatment, and your treatment must go through a certain period. We say once you've been put on treatment, there's a kit that has a combination of antibiotic and the drugs that reduce the acidity. You will take for a minimum of 2 weeks. Then after that, you continue suppressing your acidity for another 2 weeks. So that means the treatment takes about around 28 days. But it is good practice that you check again if the bacteria has been cleared from your body. This will be taken 2 weeks, at a minimum of 2 weeks from the time you clear your medication up to around 8 weeks. Now, there's something I have to mention that is very important. If you have symptoms and you go to the hospital for being tested, to be tested for H. pylori, or your doctor suspects that you have H. pylori, there are things that at least you need to have done for you to get good results. Most people will come with the symptoms and then that go to the lab for testing. But ideally, for you to get good results, at least you need to have stopped taking antibiotic for at least a month. And even the drugs that suppress the acidity, at least stop them 2 weeks prior to the testing, so that you get the actual results. Sometimes somebody has typical symptoms of H. pylori, you test them, it turns negative. Kumbe, this guy has been taking drugs, even the day before he took drugs that suppresses the acidity, so they might interfere with the result. There are several things I can talk about H. pylori, but I will keep it there. Maybe it will come up as we continue the discussion. Yes.
Very nice. Ikoje? Hawa watu wote by then nana maikuwa na H. pylori tested, kakua confirmed positive. Me in my testing. How will I test? Randomly 1, 2, 3, 4, 5 plus me. So 50% ya sisi hapa tumeitestiwa tukapatikana positive. So this is something real. Now, but I have some questions for Dr. Dongo, then maybe for you. First, is there a standard treatment? If I go, for example, to Aga Khan, I get the same treatment if I go to another hospital. I mean, it's a random treatment that you get from here, different from another hospital. The reason why I'm asking is because I once met someone mwenye alikuwa na H. pylori, then akaambiwa asitumie kit kwa sababu it is too strong. I don't know. That is something like that. Then the second question is, most of the people when nimeona kwetu, sasa I'm talking about my village, is that from my village most of the people when you present na wakapatikana na H. pylori wamekuwa women. Is there any relationship between H. pylori and sex? And third question before I go is kwa Cliff, in regard to testing, how will you now determine now this is going to give the accurate results ama kuna two standard test yenye this is you're going to do hii test kwa anyone mwenye anakuja, especially venye Dr. Donga amesema ukitumia antibiotics inaweza kupatia negative results yet uko na condition. So maybe you can start from there alafu.
Thank you, Julius. Now, the beauty about medicine is that our practice is guided by evidence. You don't just come from anywhere and then you start doing your own things. And there are guidelines for management of every condition, which is guided by the ongoing research. So the knowledge keeps changing. The principles that were used about 5 years ago might be different from what we use currently. But the bottom line is the practice should be standard everywhere. But the choice of medication varies. Maybe to clarify more, we've said that, okay, let's say a patient in Busia, one in Sirare, and another in Nairobi, presented with what we are calling dyspeptic symptoms, and they have tested for H.Pylori. One thing we are agreeing is that H.Pylori is a bacteria, and you can only treat bacteria using antibiotic. There is no shortcut about it. You will have to take antibiotic. That is number one. Number two, we are saying that because of its association with the acid and the complication it causes in your stomach, you, in addition to the antibiotic, you have to suppress the acidity. Now, the choice of the antibiotic might be influenced by several factors. If you look at the current guidelines, I don't want to be too deep in terms of the management, but there are drugs we say first line. Currently, the current guidelines we say clarithromycin-based triple therapy is the first line treatment. But you ask yourself, has this guy been exposed to this kind of drug before? So clarithromycin belongs to drugs we call macrolides. Has he been exposed to macrolides before? You know, there are certain things we'll consider. We are just from an era where we had COVID, and everybody thought that COVID is treated with azithromycin. So you found some people taking azithromycin for 1 month. Now, people who have been exposed to such kind of drug, now this first line drug will not work for them. Yes? Other factors that you will consider are now special things. Is this person allergic to this drug? If you look at the treatment regimen for H.Pylori, you will find that amoxicillin is a common drug in all this regimen that we have. What if Julius is allergic to penicillin, so he cannot be given amoxicillin? A pregnant mother comes to you and she has tested for H.Pylori. You cannot just say that this is guidelines in Asemanga hivi. Yes, we know there are certain combination of drugs we cannot use in pregnancy. Yes, so the bottom line, we are going to use antibiotic, and it cannot be one antibiotic. It can only be a minimum of 2. Other regimens has like 4. So it has to be a combination of antibiotic and a drug that suppresses the allergy. I mean, not the allergy, the acidity. Yes, but we use the same guideline. Yes, so there are things we'll have to consider.
I would just mention in regards to gender, most of my village women were affected na H.Pylori. Kuna any relationship na gender ama it is just
okay? So okay, maybe something that I didn't mention. In as far as the gender is concerned, it is not very clear whether it is common in a particular gender. Okay. But there are other factors that are associated with the H.Pylori that I didn't mention. That is very important. Number one, it is associated. You will tend to find H.Pylori in low socioeconomic, in areas with low socioeconomic status. Yes, areas that we have overcrowding. If you have a child that comes that has 2 siblings, another one has like 10 siblings. The one with 10 siblings is at risk because overcrowding is a risk factor. A child whose mother has H.Pylori is at more risk than a child whose mother is not at risk, especially if the child is still young. We just said that oral is one of the ways that you transmit. So as far as gender is concerned, it is not clear whether it is more common in women. But again, we can say, women tend to have good health-seeking behavior. So maybe they're the ones who go to the hospital more, and are likely to be tested positive. Maybe you can take that line of reasoning.
All right. My last question. Say it in nimewasahau. My last question. Kwa sababu this topic ina relate na our previous topic about how to handle breakups, especially na venye wanakuwa na stress. Now, kuna hii theory ati stress ina cause hiyo H. pylori. I don't know kama unaweza explain hiyo kitu.
Now, stress does not cause H. pylori. Okay, I need to say that H. pylori is not ulcer. It is just one of the most important risk factor for ulcer. You can have ulcer due to several other things. Now, we've also said that 80% of people with H. pylori do not have symptoms. Yeah? But now somebody might ask, how comes Okoyo has symptoms and yet Beatrice does not have symptoms? Both of them have H. pylori. Now there are factors. Number one, it will depend on which strain you have. The strain of H. pylori. Yes, some are more virulent than others. We have other host factors. If you have H. pylori and you engage in other things, like you smoke, yes, you take lots of alcohol, your eating habits are poor, you are stressed. Now, if you have other factors that are likely to trigger dyspeptic like symptoms or ulcer like symptoms, then you will likely go to the hospital and they will test you and find you positive for H. pylori. But it's not because your ulcer is what has caused the H. pylori. Maybe you had the H. pylori but you are asymptomatic. But because you have additional things that might trigger these symptoms that looks like what H. pylori would normally cause, then you are likely to present with the symptoms. I don't know whether tunaelewana hapo. Yes. Yeah, but it will not, stress will not cause H. pylori.
Wacha jibu swali yangu.
Niliuliza
in regards to testing.
Kuna standard test.
Yeah, okay, how do you now decide ndio test nafanya huyu ama
regarding that in most cases the clinicians the doctors decide on which type of test they want, but the baseline ile hata sisi tunafanya saa hii inakwanga stool test, kwa sababu unajua H. pylori ina reside kwa the gut, the stomach, na stool lazima ipitie hapo. The process ya stool kupatikana lazima ipitie through the stomach. So stool test is the baseline, but I believe that kuna kwanga na other instances that maybe consultants ama madaktari wenye wako na more experience kwa conditions za gut, they can require other blood tests like the IgG, IgM tests. Yes, kuna other advanced tests that huwa zinafanyika, but baseline hapa kwa ground stool.
Sasa kwa ground kwa mtu mwenye hawezi kutoa stool,
atatoa hata kesho. Tunampea container, anaenda analeta kesho na anaweka kidogo.
Okay.
Asijaze container.
Maybe to add something on what Cliff is saying. Yeah, what Cliff is saying is true. Like I said that the tests we do for H. pylori, we have divided them to invasive and non-invasive. And then I also mentioned the age of the patient. He has just told you that most of the time it is us who will request. Yes. So the test you request depends on several factors. He has mentioned a stool H. pylori antigen. It is relatively cheap, readily available, and the only thing we need from you is something that you would have otherwise deposited somewhere. Yes. Yeah, but there are other tests like I mentioned. The breath test. There is that stool H. pylori antigen. There is the blood test where we look at the antibodies against the H. pylori. So, as a clinician, you want to order a test that is readily available and it is cheap and you can find it everywhere. Urea breathless has higher sensitivity than the stool H. pylori test that we commonly do. But personally, I have not even seen that test. Yes, and probably you might die without seeing it. I can assure you. Yes, but we said for people who are 60 years and above and they have these symptoms, then just testing stool is not enough. The best is you do endoscopy, you get a sample from the stomach and test. So,
fans, if you love what we do, kindly support us by subscribing. Make sure you share with friends and family, like hapo na comment. Now we move to this side ya crew.
Oh. So kama kuna mtu ako na swali, can ask. Anyone?
Mimi usiniulize, unauliza tu daktari. Oh, uko na simu.
Three questions. Question number 1 to Dr. Is there a relationship between reflux and H.Pylori? Because you find that patients who present with reflux tend not to have H.Pylori in most of the cases. Then the second question is chances of recurrence. Because when you alishapatikana na hiyo H.Pylori, what's the percentage of chances of recurring or having H.Pylori again? Then the last one, why is it so common in this generation compared to the past? Yet I tend to think that modern life imefanya mambo itakuwa better compared to kitambo.
So, thank you, Beatrice. I think you've asked 3 questions. I will start with the first one. The first one was whether there is a relationship between reflux and H. pylori. Now, okay, again, I didn't go into deeper details, but at least you are now prompting me. So, what we say, what research has shown, we've said that for the people who have H. pylori and are symptomatic, they present with what we call dyspeptic symptoms. Now, somebody can have dyspeptic symptoms plus symptoms of reflux. I said that the dyspeptic symptoms are things like you have abdominal pain, most of the time burning abdominal pain, especially in the upper abdomen. That is worse when your stomach is empty. But you have other things that can also present, like nausea. Some people vomit, some people feel like the stomach is full all the time and your stomach is rumbling. Now, these people might, in addition, have what we call reflux-like symptoms. The reflux-like symptoms, most of the time, the pain that you normally feel in your stomach, you feel like it is now coming into your chest. What most people call heartburn. And because it is coming into your chest, you can end up having a recurrent sore throat, and some people cough and cough. Cough and cough. Unapewangwa tu antibiotic or anti-allergy, the cough is persistent. Sometimes you feel like the saliva is a bit sore, kama kuna chumvi kwa saliva. Those are more like reflux-like symptoms. Now, somebody with H. pylori can have both symptoms. But what this research has shown that if this person comes to you and you test for H. pylori and you treat the H. pylori, the symptoms that are likely to disappear are the dyspeptic symptoms. But the reflux-like symptoms will not improve. They tend to persist. I don't know whether I'm making sense. Bottom line, H. pylori gives more dyspeptic symptoms than reflux symptoms. But even for those who have both, if you treat them for H. pylori, the dyspeptic-like symptoms are likely to disappear, but this is a reflux will remain the same. Have I answered you? Yes. So people who tend to have more reflux symptoms, they will test negative for H. pylori. But even if they test positive, even if you treat them, these symptoms are not likely to improve because we have other things that causes the reflux, other factors that we'll not talk about today. Number two, the question was the tendency to recur, the recurrence. Now, the recurrence we are seeing, okay, I don't have the exact data on what percentage of people tends to have a recurrence of H. pylori, but we are seeing a lot of people who have been treated for H. pylori again testing positive. And there are several factors that can explain this. Now, one of the main things why we have to discuss H. pylori today is the abuse of antibiotics and the increasing antibiotic resistance. I can tell you in the next, I don't know how many years, we are going to have problems because you will be taking antibiotic na bacteria zinakuangalia tu hivi. Because even the drugs that we are saying, the first line drug, which is the clarithromycin based triple therapy, the resistance against the clarithromycin is continuously rising. And right now, it is only considered as a first line drug if your local resistance is below 15%, which is of course difficult to know. Can you know the local resistance yourself? No. So we will continue using whatever is available. But maybe the drugs you give these people that have already developed resistance. The other thing that can contribute to the increasing rate of resistance is that there are challenges that that comes with the treatment of H. pylori. Number one, the kit has a lot of drugs. So adherence is likely to be poor. Yes. So even your patients we are treating for H. pylori, you have to really ensure that they adhere to their drugs, because if they don't take their drugs well, imagine taking antibiotic for 2 weeks. It's not easy. Yes, some of them come with side effects. Some of them just fear because of the number of drugs, and the resistance is also playing a role. So yes, the recurrence rate is increasing because of several factors, and one of the things is the resistance rate. Yes. The other question, the third one?
The question number 3 alikuwa anauliza why is it that iko on a high level right now as compared to previous.
Okay. Yes.
Contemporary.
Yeah. Okay. That you can look at that question in different ways. We don't know whether it has increased now or before. But what we know that at least now most people have a lot of symptoms and they come to the hospital. It could be because of the awareness that we are creating right now. You know, some people when they have those symptoms, they tell you, wewe uko na ulcer, chukua dawa umeze. When you suppress the acidity, you feel well temporarily, and then your symptoms. But at least right now, because of the awareness, people are going to the hospital. And then we say that 80% are asymptomatic. So the people who are becoming symptomatic currently is also likely to increase because of other things that people engage in, the lifestyle. Yeah? I can tell you even among us here, there are people who don't take lunch every day because they think they are very busy. So you leave your stomach exposed to acid for a very long time, so that even if you had a silent sleeping H. pylori, you start developing symptoms because there are other additional things. So people are smoking, people are taking alcohol, people are taking a lot of fatty foods. Yes. So I think that is also increasing. The number of people presenting with the symptoms. And that's what I will say.
I have a question for Doc from the diagnostic point of view. Sometimes when you do the test in some patients, you'll find the titers being so low or being so high. Tentatively, by just looking at the test line, you know, maybe some viewers might not understand, but sometimes you can find the test line is so faint, even in someone who has never had a previous case of H. pylori. Some, the test line inakuwa very very sharp. How does this help you in making decisions in terms of treatment?
So in terms of decision making to treat for treatment, we don't care whether it is faint or strong. The bottom line is anybody with symptoms and has tested positive for H. pylori must be treated. That is the bottom line. Of course, being faint or strong might depend on certain factors. Maybe this guy has been taking some antibiotic and has not. Okay, you tested when they had not stopped taking antibiotic at least for a month. We said for you to get good results, you need to have stopped antibiotic for at least a month. You need to have stopped the drugs that lower the acidity, like omeprazole, for at least 2 weeks for you to get good results. But some people come when already they are on drugs, so that can reduce. You know that this is a bacteria, yes, and the bacterial load determines the outcome of the test. Yeah. But once you give me the positive results, utakula dawa baba.
Positive is positive.
Yes, unafaa umeze dawa.
Anyone with the question from the crew? Hamna maswali?
Avin ako na swali.
My name is Avin. I think I have a rejoinder to this question, which doubles as a question. Could it be that the stress levels that we currently have in this generation is contributing to the rise in H. pylori infection? Of course, I believe that as you said, right now many people are going for lab tests, and like Tambo, many people are not going for the lab tests. So could it be that the stress level? Now I'm thinking in the line of stress versus immunity, because definitely once you have stress, your immunity has to be affected. So does this predispose someone to having or contracting the H. pylori infection? And then number 2, this is now from practice. There was once a patient who brought a child. I think that must have been a year old, and they were shocked that the child had H. pylori infection. And as people out there, the layman says that is ulcer. So is there an association between age and H. pylori infection?
Thank you, Avin, for the 2 questions. I'll start with the first one. Stress does not cause H. pylori. That is the first point. Most of the people who test for H. pylori right now, most likely they acquire it. We said the majority of people with H. pylori, they acquire it during childhood. Majority actually acquired before the age of 10. Yes, but of course a number of people can also acquire it along the way. But by age 50, about 80% will end up having H. pylori wamekuwa nayo already. So you just have your H. pylori unatembea nayo. It's just that you are asymptomatic. But because of certain things that can end up happening in your life, you start developing symptoms. You know, you can even develop symptoms of H. pylori if you don't have H. pylori. So, we've said that we are grouping these symptoms as dyspeptic-like symptoms, which can be caused by so many things. Some people put it in simple terms as hyperacidity. If you are stressed, you produce a lot of acid. And we've said that H. pylori has already destroyed your mucosal lining. So somebody who had H. pylori which was silent but is now having stress and is producing a lot of acid is likely to be symptomatic. It's not like the stress has caused the H. pylori, only that you have now multiple factors playing, and then you're likely to develop symptoms. Now, H. pylori, we've said it causes other complication. We've talked of gastritis, we have talked of stomach ulcer, we have talked of the cancer. So if you have something that is likely to cause you this, then you add stress, which is also likely to lead you in this direction, then you are likely to develop symptoms. And yes, I can agree with you. People who are stressed are more likely to be symptomatic, even if they had a silent H. pylori. So,
Yes.
I don't know whether you're satisfied.
I was asking in relation to immune system, not like the stress is causing H. pylori,
Yes.
but the stress is suppressing your immune system,
Yes.
which would that now that you have a suppressed immune system,
Yes.
because we expect that the immune system will naturally fight the germs.
Yes.
So does it mean that if you have a suppressed immune system, it can give a chance to the bacteria to
Yes.
invade or whatever?
Yeah, so the stress can make you symptomatic in different mechanisms. One, we have just said, increased acid production. Number two, in your line of thought. You know, when you are stressed, your immunity goes low. And you're likely, even the normal bacteria that under normal circumstances will not give you symptoms, they start giving you symptoms. And then we said, of course, one of the main processes that the H. pylori ends up causing you problem is through the inflammatory process. So yes, there is a correlation with your immune system. Now, in your second question about the child, now people get surprised that, mtoto ni 2 years na akona H. pylori. That is the time that actually they get the H. pylori. Ni ile tu, most of them, they fall into the group that do not have symptoms. But most of the H. pylori that we are testing and finding positive currently, they acquired it when they were young. Only that at that time they didn't have symptoms. Yes, and of course there is no policy of mass screening for H. pylori now. We only test those who have symptoms. And the rule is very simple. You have symptoms and you have tested positive, you have to be treated. Yes. So most of the acquisition is in childhood.
That's the last question.
So, sir, if for example I don't have symptoms but nikaona, let me just go to the nearest clinic nipime to H. pylori, because there are guys who are watching us today. They might be prompted to do what I'm saying. You go to a hospital, then you test to kapatikana ukona, but hauna symptoms. Should you now start the treatment? Since you have symptoms, I don't need to treat it.
So Julius has mentioned something very important that I didn't want to bring, but now let me explain it. We have a special group of people whom we test for H. pylori, or ideally should be tested for H. pylori, even if they don't have symptoms. Before I go to your question, I will have to mention this now that you brought it. Any patient who is going to be put on long-term drugs like NSAID are non-steroidal and inflammatory drugs, things like brufen, diclofenac. Let's say you have arthritis, tumesema uko na arthritis and you have to be on long-term NSAID. Ideally, this person should be tested for H. pylori, even if they don't have the dyspeptic symptoms we are talking about. Another special group is if you have iron deficiency that cannot be explained, you need to be tested for H. pylori. If your platelets are just persistently low, for a special group we say the immune thrombocytopenic purpura, people who are having low platelets and we cannot explain why, and we are thinking that maybe it is because of the immune system, they need to be tested for H. pylori. People who have had stroke and they are going to be put on aspirin for a very long time to prevent another recurrence, they need to be tested for H. pylori. The reason why we are saying all this, because like for people who are going to be put on NSAID, if you have H. pylori and you are also taking NSAID, then we say, my friend, you will not avoid, the chances that you will avoid ulcer is very small. You are most likely going to develop ulcer because these two factors are going to work in damaging your stomach. Now, if you decide that you have a lot of money and you're coming to test yourself for H. pylori. Of course, we don't say that people should go routinely to check H. pylori in the hospital, even if they don't have symptoms and you don't belong to this special group that I've mentioned. We don't encourage that people just go to the hospital and test for H. pylori. But us in the hospital, my friend, if we test you and we find you are positive, we will treat you.
Okay.
Yes.
Wacha to introduce new crew member before ulize swali. Please give her the phone, aseme jina yake, tumkaribishe kwa crew.
Habari zenu.
Nzuri sana.
I'm Vivian Mata, YouTuber, and for YouTube it is B Mata.
Oh, okay. Welcome to Black Adam TV. Sawa, uliza swali.
My name is Grace. I was asking, can someone fully recover?
From H. pylori?
Yeah.
Yes, you can fully recover. H. pylori is a bacteria, and just like any bacteria, the goal of treatment is we have to eradicate it. That's why I said, you come today, you test for H. pylori, we give you the kit for 2 weeks, you continue with the drugs that suppress the acidity for another 2 weeks, then we'll tell you at least rest for 2 to 4 weeks, then you come back. Ideally, you need to come back to check for eradication. Yes, but majority of our patients whom we treat, when they come back and we check, we find that they're negative, and most of the dyspeptic symptoms disappear.
Good. Question.
Yes.
Is there another option apart from the kit? Is there another way you can manage H. pylori and be free from it? Because
Yeah, okay, so research is something that is ongoing, and of course the medicine is changing every day. But as far as we are concerned currently, we started by saying that H. pylori is a bacteria, and bacteria should be managed by antibiotic. Yes, so the kit will always have antibiotic, and there is no kit that has one antibiotic. It is 2 and above, depending on penye umefika. Yes, so you have to take the antibiotic.
Inaweza kuwa ni jina linamtisha.
Oh, one last question.
I have tested positive for H. pylori sometime last year. It was the beginning of last year. And I was put on treatment. The kit I used it for 2 weeks, and I was put on omeprazole for, I can't remember, but it was a couple of days. Went back for the test again after medication, and the results came out negative. But since I am having sporadic bloating, to call it acid reflux, this thing that chokes your throat. I keep having that on and off. I'm completely unable to eat cold food. Completely unable to eat food in Melala. Is that related to the H. pylori, or it could be something different?
Yeah, so it is good at least we have somebody with experience. If you followed my discussion, I said the research has shown that treatment of H. pylori will most likely not improve your reflux-like symptom. The symptoms that are likely to disappear are the other symptoms, the abdominal pain and whatever. Yes. But if you still have those symptoms, you still need to check for H. pylori. So if your H. pylori is negative and you still have the persistent reflux-like symptoms, then probably you need to go for something else. And one of the things that probably would require you to go for is endoscopy. And there are things we are interested in. There are other things that causes reflux other than what we have discussed. Yeah, it could be even you are born with a problem, what we call a hernia, where your food pipe, what we call the esophagus, as it pierces through the diaphragm, usually it should be held tight. Now some people that what we call the the gastroesophageal junction, where the diaphragm is supposed to be holding it to prevent food from coming up, is a bit loose, what we call hernia. Those are the things that we can detect when you do endoscopy. But of course, since you have had the symptoms for a long time, we need also to check whether they have already started causing other problems. So yes, you need to repeat the H. pylori, but remember, even if you repeat the H. pylori and we treat you, then what is likely to disappear is maybe bloating, but your reflux will not improve. So you need to start thinking of doing an endoscopy to find out whether there are other things that might be causing your reflux. Yes.
That's a good one.
Swali la mwisho tukifunga.
Last question. Anybody? Nyakarachana. So we close it. Aye.
Good night.
Think we.
My question, you talked about the different strains of and I'm just thinking, okay, you come to the hospital, your diagnosis comes out you have a certain strain of senior, and then maybe you're on medication, or maybe you're done with the medication, I don't know, whatever. Then you've talked about saliva to saliva as well. Yes.
No more
Then someone does the saliva thing with you.
Say it.
Yes.
You mean deep
He
kissing?
says you.
Yes. French. French.
What is that?
Yes.
It's French kiss.
Next topic.
Next topic.
Yes. Then you get their strain. Maybe they had another one. You get their strain. Like, how can that complicate your day?
I don't know if it is.
So, as you answer the question, you summarize.
Okay. Thank you, Wendy, for the question. Wendy is worried about the strain.
And kissing.
Yeah, it is good to know that at least we now know that H. pylori can be transmitted through kissing.
Mouth to mouth.
Yes, yes.
Also, some people are kissing each
Aromatherapy.
Yeah. So your question is that you've tested for H. pylori and you're on treatment.
Yeah, you're on treatment.
Yes.
But the strain that you're having is not the same as that one you're going to have when you kiss someone.
Yes.
Something another.
Yes, yes. Okay, please, before I answer the question, the next time you kiss someone, don't be thinking about the strain. Just if you have decided to kiss, just kiss out of love, like let's put it there. Yes, yes. Now, we don't know how it is going to complicate your life, but what we are saying that you continue their treatment, like we have told you, take your kit. After that, take your omeprazole, whichever drug you are taking to suppress the acidity, but you need to come back. Yeah, that is why you need to come back, because you don't know whether you are kissing while taking the drug. Just come back 6 weeks from the time you started your treatment, so that we check for the eradication. Yes, so probably by that time we find you are still positive, then we can start thinking about the kissing and the strains. Yeah. Yes, yes. So as we summarize, okay, I need to just put a few points clear. Number one, we've said that H. pylori is not ulcer.
Yes.
Sawa? If you have the symptoms you have talked about, I will repeat them again, because we need you to go to the hospital. Don't go and buy drugs over the counter.
Yes.
Because you could be treating a wrong thing. If you have abdominal pain that is burning most of the time, and it is worse when your stomach is empty, that is in between the meals or late at night, and you experience this bloating, sometimes you feel nauseated, sometimes you vomit, sometimes you feel a lot of rumbling, go to the hospital and be tested for H. pylori. Most likely the doctor you find will think along that line. And if you are tested, you need to take your drugs well, because if you don't treat your H. pylori and you are going to have the H. pylori for a very long time in your stomach, you are at risk of getting the ulcer that you think that you already have. Maybe you have it by the time you are coming, but at least come we test for the H. pylori so that you don't get the ulcer. And remember, if you have the ulcer that is not taken care of, you are at risk of getting the stomach cancer. So usipuuze symptoms, enda hospitali. Thank you.
Tukimalizia, thank you guys for coming.
Thank you.
Thank you, Dr. Dongo, for coming. We love you, by the way. And don't Google your symptoms. Go to the doctor. Thank you so much. Goodbye.
Bye-bye.